Hello everyone. Today we'll discuss about the megaloblastic and the pernicious anemia. Now we all know basically in anemia there is decrease in the amount of red blood cells in the body, and so by this the hemoglobin content in the body also decreases and the oxygen carrying capacity of the red blood cells also decreases. But especially in the megaloblastic anemia, what happens is there is increase in the size of the red blood cells. So as you can see over here, this is the normal red blood cell having the normal size of about 7 micrometer. But in the megaloblastic anemia, as you can see, there is increase in the size of the red blood cells. And so the megaloblastic anemia is specifically characterized by abnormally large size of the erythrocytes. Now, what causes the large size of the RBCs in the megaloblastic anemia? So over here in the megaloblastic and the pernicious anemia, the large size RBC are caused due to the deficiency of the vitamin B12 or vitamin B9. Now, how the deficiency of the vitamin B9 and the vitamin B12 causes the megaloblastic anemia? So as you can see over here, the vitamin B12, that is the cobalamin, and the vitamin B9, that is the folic acid. These two vitamins are very important for the formation, or we can say for the DNA synthesis and the DNA formation. And as because these two vitamins are deficient in the megaloblastic anemia, deficiency of these two vitamins causes the defective DNA synthesis. And because of the defective DNA synthesis, there is abnormal large size of the RBCs, leading to megaloblastic anemia and the pernicious anemia. Now, what is the difference between the megaloblastic and the pernicious anemia? So, megaloblastic anemia is actually a type of macrocytic anemia. Now, what is macrocytic anemia? As the name says, macro means big and cytic means cells. And the large size RBC is because of the deficiency of vitamin B9 and or vitamin B12. And the pernicious anemia is a form of megaloblastic anemia. Okay, so we can say that in short, both the megaloblastic anemia and the pernicious anemia are same. But over here, there is still some difference. Now, what's the difference? So over here, the megaloblastic anemia is due to the deficiency of the vitamin B12 and or vitamin B9. Okay, means the patient is actually not intaking sufficient amount of vitamin B9 or vitamin B12 in his or her diet. Means his particular food supplement is actually deficient from the vitamin B9 or vitamin B12. And the pernicious anemia is due to the lack of absorption of vitamin B12. Over here, understand the difference. What's the difference over here? In the megaloblastic anemia, there is deficiency of vitamin B12 or vitamin B9. Means over here, there is a less amount of vitamin B12 or vitamin B9 in the diet. Okay, the body is not getting the particular amount of vitamin, right? But in the pernicious anemia, there is normal and the sufficient amount of vitamins, especially vitamin B12 in the diet. Okay, but the body is not able to absorb this particular amount of vitamin B12. Means the body is getting the normal amount of vitamin B12 but is not able to absorb. And unless the particular vitamin is not absorbed, the particular vitamin can't be used up by the body. Okay, so absorption is very important. So deficiency of the vitamin in the diet is named as megaloblastic anemia, and lack of absorption of the vitamin, especially vitamin B12, even after taking sufficient amount of vitamin B12 in the diet is known as pernicious anemia. Now, what causes the pernicious anemia? Over here, there is failure of the secretion of the intrinsic factor by the stomach. And this intrinsic factor is very important for the absorption of the vitamin B12. So now you got the clear difference between the megaloblastic and the pernicious anemia. Now, what are the common symptoms seen in the anemia? So, of course, there is yellowing of the eyes, paleness of the skin, there is shortness of the breath, there is muscular weakness, there is spleen enlargement seen. The blood pressure becomes low because there is decreased amount of RBCs and the blood in the body, and also the person becomes fatigued easily and even faints because of the decreased amount of RBCs in the body, and so there is decreased amount of oxygen content in the body. Now, what are the causes of the vitamin B12 deficiency in the body? So, over here, the prime cause of the vitamin B12 deficiency in the body is because of the lack of vitamin B12 source in your diet. And because of the inadequate dietary intake of the vitamin B12 in the body, this causes the vitamin B12 deficiency anemia. And over here, the B12 deficiency anemia is commonly seen in the strict vegetarians and in the breastfed infants, because commonly vitamin B12 is seen in the non-vegetarian food items and also in the water which is not over purified. Now what do I mean by this? Whatever water we drink in our house that is actually purified by the RO plants are very much purified, means they are over purified, and because they are over purified, whatever vitamins present in the water are also purified along with the dirt and the impurities. Okay, and along with those, vitamin B12 is also washed out and purified. And so because of this, in today's date, many people are suffering from vitamin B12 deficiency. Deficiency of vitamin B12 in the diet is not only the reason, it may be also because of the malabsorption. As I told you before also, that in the pernicious anemia, there is decrease in the absorption of the vitamin B12 by the body itself. Okay, even you are having normal and enough amount of vitamin B12 in the diet, because the body is not able to absorb vitamin B12, there is decrease in the usage of the vitamin B12, causing the megaloblastic anemia. Now the reason behind the malabsorption of the vitamin B12 is due to the deficiency and the failure of the secretion of intrinsic factors. Now this intrinsic factors in the stomach causes the absorption of the vitamin B12. But as in the autoimmune disease or in the gastrectomy, okay, these vitamin B12 absorbing intrinsic factors are not able to secreted by the stomach, and as because of this causes the malabsorption of the vitamin B12. So in short, in the autoimmune disease or in the gastrectomy or in the congenital lack of intrinsic factors, there is malabsorption occurring of the vitamin B12 by the body, even you are intaking normal amount and the sufficient amount of vitamin B12 in your diet. And because of decrease in the absorption and the lack of absorption of vitamin B12, this is causing megaloblastic anemia. Simple. Now what are the causes of the folic acid or vitamin B9 deficiency anemia? So of course, we all know the prime reason behind the any kind of deficiency in our body, it is because of the dietary intake. Deficiency of the particular vitamin dietary intake will cause the particular deficiency in our body. So the prime cause over here is the inadequate dietary intake of vitamin B9. The next cause can be of course the malabsorption, and this malabsorption can be seen in the celiac disease, tropical flu or in the Crohn's disease. The other reason can be the increased demand of the folic acid as seen in the pregnancy, lactation or in the infancy. As over here in these cases there is increase in the demand of vitamin B9. As in the lactation and the pregnancy, there is increase in the demand of folic acid by the body. And also in the infancy, for the developmental purpose, there is increase in the demand for the folic acid by the body. And if you are not supplying the particular enough sufficient amount of folic acid, the deficiency occurs and so the megaloblastic anemia occurs. Even some drugs can cause vitamin B9 deficiency in the body, like contraceptive pills and certain cytotoxic drugs like the methotrexate. Now let's check the lab findings. Now first of all about the blood picture and the red cell indices. Now as you can see over here, this is the CBC report of the patient suffering from the megaloblastic anemia. So this is the patient's value and this is the normal range. So as you can see over here, the red blood cells in the patient's body is of course decreased. The hemoglobin content and the hematocrit value is also decreased. Now let's check the red cell indices of the patient. Now as you can see over here, this mean corpuscular volume is increased. It is 104 over here and its normal range should be between these. And also the MCH, the mean cell hemoglobin, that means the average weight of the hemoglobin contained in a single RBC, it is also increased. And so the increment in the MCH and the MCV, the increase in these two red cell indices basically shows the megaloblastic anemia. Why? Because over here there is defective DNA synthesis occurring in the body because of the deficiency of the vitamin B9 or vitamin B12 in the body, and these basically causes the abnormal large size of the RBCs, okay, showing the increased value of MCV and MCH in the CBC report. Now you might think that why this MCH is more in the body and this hemoglobin content in the body is less. This MCH, that means the mean cell hemoglobin, that means the average bit of hemoglobin contained in each RBCs. Okay, and this is more. Okay, and this is less. Why? Now over here don't get confused. As we know that in the erythropoiesis process, in the beginning, the cells in the beginning are very large, okay, and as the process goes, okay, it becomes smaller and the final mature RBC is very small, about 7 micrometer. But in the megaloblastic anemia, as because there is deficiency of vitamin B12 and vitamin B9 in the body, thus red blood cells needs these two vitamins to become mature, okay, and for the DNA synthesis these two vitamins are very important. But as these two vitamins are deficient over here, they won't be able to become mature, okay, and as because in the body the mature hemoglobin and the mature RBCs becomes less, and as because of the defective synthesis of the DNA and the defective synthesis of the RBCs in the body because of the deficiency of the vitamin B12 and vitamin B9, there is abnormally large RBC seen, okay, and because of this there is immature RBC and immature hemoglobin present over here, and so because of this MCH value is seen high over here, and this normal RBC and the normal mature hemoglobin, these two are shown less. Now as you can see over here, there is no impact seen in the MCHC. The MCHC is normal over here. So in the megaloblastic anemia, these two red cell indices MCV and MCH are increased. Now as you can see over here, this RDW means red cell distribution width, it is also increased over here, and this RDW increment is a very clear notification of the deficiency of any kind of nutrition in the body, especially in the case of anemia. So in case of folic acid deficiency, in case of B12 deficiency, or even in the case of iron deficiency anemia, there is increment in the RDW in the CBC report. Also, as you can see over here, there is nucleus seen in the RBCs of the patient suffering from the megaloblastic anemia. And the very common reason behind this is, we all know, that means the particular RBC is immature, okay, and because of the deficiency of the vitamin over here, the RBCs are not able to grow enough or become mature enough, and so nucleus is seen over here in the RBCs. Also, the reticulocyte count is of course increased because the RBCs are not able to become mature enough. The lifespan of the RBCs decreases, and the WBCs and the platelet count in the body also decreases in the megaloblastic or the pernicious anemia. Now next is about the bone marrow picture. Now over here there is 70% of the pro-erythroblast and the early normoblast seen. In the normal healthy human being, this pro-erythroblast and the early normoblast are about 30% in the bone marrow picture. Okay, but in the megaloblastic anemia patient, these two becomes 70%, which is normally 30%. While there is 30% of intermediate and the late normoblast, and these two are about 70% seen in the normal healthy. So by this, in short, we can say, so immature blasts or immature cells are increased, and the cells which are about to become mature are decreased. Now next is about the biochemical findings. Now over here, the bilirubin content in the body is increased. Why? Because there is excessive destruction of the RBCs in the spleen, liver and bone marrow, and because of the increase in the bilirubin in the body, this causes jaundice. So remember, in the megaloblastic anemia, jaundice is seen in the patient. Now next is about the urine urobilinogen. So it may increase because over here the bilirubin content in the body is increasing, and so the bilirubin is basically oxidized into urobilinogen in the gut. Okay, and as because of this, the urine urobilinogen is increased in the patient. Now next is about the serum iron and ferritin. Now they are increased. The serum vitamin B12 is of course decreased, and the vitamin B9 is also decreased. So now one question might come in your mind, that how to know that the patient is suffering from vitamin B9 deficiency or vitamin B12 deficiency anemia. Because anemia caused by deficiency of these two vitamins are commonly called as a megaloblastic anemia, right? But how to know the difference? Now the primary and the very first step you can do is, of course, ask the patient to do the complete B complex blood testing, and by looking at the blood CBC report, you can check that whether the patient is suffering from vitamin B9 deficiency anemia or vitamin B12 deficiency anemia. And after this, you can easily provide them the complete supplement and the enough supplement of vitamin B9 or vitamin B12. But without looking at the CBC report, how can you identify the particular vitamin B9 or vitamin B12 deficiency anemia? So over here, remember, in the vitamin B9 or the folic acid deficiency anemia, there is only anemia seen. Okay, But in the vitamin B12 deficiency anemia, there is some kind of neurological symptoms also seen in the patient. So in the vitamin B9 deficiency anemia, only anemia. Okay. And in the vitamin B12 deficiency anemia, along with the anemia, there is some kind of neurological symptoms also seen in the patient. Now also what happens sometimes, even after providing vitamin B9 and vitamin B12 to the patient suffers from the anemia. Now what's the reason behind this? Of course, because the body is not able to absorb, the patient is suffering from the anemia, right? So the patient is suffering from the pernicious anemia. Now the very important part, how to treat this type of anemias. So the prime treatment is have normal and the enough and the sufficient amount of vitamin B9 and the vitamin B12 in your diet. And even if this doesn't work, have the extra supplements in the way of tablets. Also, now there are many purifiers available in the market which do not remove the important vitamins from your water. Okay, so just buy them, because apart from the non-vegetarian items, water is also one of the most important source of vitamin B12. Also, you can have vitamin B12 and folic acid supplements by the way of tablets. So today up till here, I hope you understood it well. Thank you so much.